Hey everybody, it's Dr. Charles Maudlin, your friendly urologist, here with another health equity brief. As you know, as I've indicated, these health equity briefs are an opportunity for me, Dr. Charles Maudlin, urologist, kidney transplant surgeon, health equity champion, to relate information to you, the listening audience, that I think is important for you, your family, your community to improve and maintain your health. These health equity briefs also are very educational for me in terms of researching a lot of the health disparities that exist. And I came across a significant health inequity, health disparity that I think is very important for all to know, especially African American populations. So the topic of discussion today is disparities in the use of physical therapy and rehabilitation services in African Americans compared to other populations. So disparities in healthcare utilization, including physical therapy and rehabilitation services, are significant in the United States. African Americans often face barriers in accessing these services compared to white Americans, which can exacerbate health disparities associated with various conditions. This brief, therefore, will examine the disparities in the utilization of physical therapy and rehabilitation services and the reasons behind these disparities and relevant statistics. So let's get started. Regarding lower utilization rates of physical therapy and rehabilitation services in African Americans, studies show that African Americans are less likely to utilize physical therapy services compared to white Americans. For instance, a study published in the Archives of Physical Medicine and Rehabilitation found that African Americans were significantly less likely to receive physical therapy after total knee arthroplasty compared to white patients. That reference is Harris et al. 2016. Be interesting to see what current data shows. According to the National Health Interview Survey, only about 23% of African American respondents reported utilizing physical therapy services compared to approximately 34% of white respondents, CDC data. Some of the conditions affected include disparities in physical therapy utilization, evident across various health conditions, including musculoskeletal disorders, where African Americans often report higher rates of conditions like osteoarthritis. We talked about that in a different health equity brief, and higher rates of lower back pain, but use physical therapy less frequently than white individuals. Let's look at stroke rehabilitation, very important. A study found that African Americans were less likely to be referred for rehabilitation services after stroke, and this affecting recovery outcomes. That's very significant. Factors contributing to these disparities we've talked about in other health equity briefs: socioeconomic barriers, factors like lower income, lower access to health care, lower lack of access to health insurance coverage. All of these social determinants significantly impact access to physical therapy. Other cultural and social determinants may influence a willingness to seek physical therapy. Mistrust in the healthcare system do play a role. We've talked about that before, and that stems from historical injustices that may deter African Americans from accessing rehabilitation services. Social determinants such as transportation challenges, neighborhood resources, etc., can complicate access to physical therapy. Provider biases and disparities in referral. So implicit biases among healthcare providers can lead to disparities in referrals for physical therapy. That should not be the case. Studies suggest that providers may underestimate the severity of pain in black patients or may not provide adequate referrals compared to their white counterparts. I've covered that in another health equity brief. Go to my YouTube channel and look at some of the other health equity briefs I've presented. Awareness and education. There may be lower awareness of the benefits of physical therapy among African American communities, as well as limited education on available services. That's the responsibility of the healthcare providers to provide them with that knowledge and awareness and education. And this can lead to underutilization, underutilization, as individuals may not seek help when needed. So, a study highlighted that only 47% of African American patients receive physical therapy after orthopedic surgery, compared to 64% of white individuals. That's a significant difference. A systematic review indicated that African Americans are approximately 25% less likely to receive physical therapy following a stroke compared to white patients. So, what are some of the recommendations to address these disparities in physical therapy and rehabilitation services utilization and referral in African Americans? As I mentioned, we need to increase awareness and education. The onus is on the healthcare providers, as far as I'm concerned. Culturally competent care, implicit bias training. The onus is on the healthcare provider, as far as I'm concerned. Policy changes need to be made, advocating for policies that enhance insurance coverage, access to care. We've spoken about that. So in conclusion, disparities in the utilization of physical therapy and rehabilitation services among African Americans compared to white Americans are evident across various health conditions. Socioeconomic factors, cultural belief, provider biases, and systematic barriers contribute to these disparities, resulting in poorer health outcomes for African Americans. Addressing these issues through education, culturally competent care, policy changes is essential for promoting health equity and improving access to rehabilitation services. By understanding and addressing these disparities, healthcare providers and policymakers can work towards improving access to physical therapy and rehabilitation services for African Americans and other minority populations. Please like, share, subscribe, pass this information along, spread the word about these important disparities and others. You can find my other health equity briefs on my YouTube channel, Facebook, X, and LinkedIn. And until next time, I'm Dr. Charles Modlin, and I'll see you on the next health equity brief. Thank you for joining me. Stay safe.